Public health officials have broken their silence on the controversies surrounding the care of a senior citizen at the Owen King EU hospital. Della Ashby claims that her 71-year-old diabetic father, who was taken to Okeu EU for treatment, was transferred to the Victoria Hospital for COVID-19 evaluation and tests without notifying his family.
We spoke to him. He told us that they didn't even tell him that he was going to Victoria. When he was put in the ambulance, he asked them, what are they doing with him, where are they taking him? And that's when he was told that he's going to Victoria Hospital. They tested him for corona, they did not inform us. They put him on the ward, they did not inform us. And by Sunday evening, we were just adamant that we needed to get information on our father. We needed to know where he was and what was happening to him.
Executive Director of Okeu EU HVH, Nancy Francis, announced on Wednesday, August 19th, that matter will be investigated following a review of the official report on the incident and a meeting with Della Ashby. Authorities have cited deficiencies in communication, a breach of established processes and protocols, and human resource-related matters in relation to the incident. Francis concedes that there are teething problems with telecommunications equipment, but indicates that this by no means absolves the institution.
I also want to indicate at this juncture that it is not an excuse for staff members to refuse to contact family members when there are important matters relating to a patient or a next of kin that must be communicated to. This matter will be investigated and we will review the charts, the logs, to find out what transpired so we can take the necessary remedial action.
Public health officials have also vowed to address perennial issues of a seeming lack of customer relations and bedside manners.
It is an ongoing process. It will take time because we are working with humans and with people and with each other, and the dynamics are different. But we will not compromise patient safety because a staff member erred or they did not follow the correct established protocol.
Medical Director, Okeu EU HVH, Dr. Alicia Eugene Ford, who says the hospital takes responsibility, sought to explain the initial clinical care process.
Usually when a patient comes to the Owen King European Union Hospital, they may come for particular symptoms not related to COVID at all, and we see them. But then when they're being processed or when they're being triaged or initially assessed, we would realize that they actually have other symptoms that would have the clinical team thinking, does this person have COVID as well? Is there something underlying that we need to rule out? And that is one of the reasons we transfer patients from Owen King EU Hospital to the respiratory hospital, because we really want all respiratory cases, all symptoms that are respiratory, like any respiratory-like symptoms, to go to the respiratory hospital.
The Executive Director, Nancy Francis, says the matter will be further investigated and a further statement will be given to the daughter and family of the aggrieved senior citizen. Colby DeVoe, HTS News Force.